world. Now, before I go on, please note that interpretation of this event is available in all UN languages, whether people are speaking live or on video. If you click on the interpretation button, which you can see marked by a globe at the bottom of the Zoom screen, you can choose the language you would like. And that's if you're on Zoom, not if you're on YouTube. But back to the report. The hope is that this report will be fundamental for the millions of people working in the field of mental health, whether they're providers of healthcare, funders, advocates, or crucially, people with lived experience. Now, to introduce myself, my name is Claudia Hammond. I'm a writer and broadcaster, and I specialise in mental health. I've been presenting radio programmes and podcasts for the BBC for the past 15 years and have reported on the topic for a decade before that. Voice. But of course, that is not everyone and that is not everywhere. And so I'm delighted that among our many eminent and inspiring speakers who are here to celebrate the launch of the report released today and who are demonstrating their own personal commitment to this area, we have several people with us with lived experience of mental health conditions, and they have much to share with us too. Now, almost 1 billion people across the world experience mental health conditions, and mental health is, of course, a crucial topic to address. Now, this is the most comprehensive report on the topic since the turn of the century, and we hope that it urges mental health decision makers and advocates to step up commitment and action and to change attitudes and approaches to mental health, to its determinants, and overall to mental health care. Now, during our time today, we're going to hear from eminent speakers from around the world. We even have a famous singer performing especially for us. And I'd like to extend a really warm welcome to all of you who have joined us today. So it is time for our first speaker. And I'm delighted to say that we have a video especially recorded for us from His Excellency, Mr. Alberto Fernandez, who is the President of the Republic of Argentina.
En primer lugar, quisiera agradecer a la Organización Mundial de la Salud por la invitación al lanzamiento de este informe. Los temas de salud mental vinculados a las consecuencias derivadas de la pandemia están cada vez más presentes en la agenda global. La pandemia es una experiencia muy dura que generó mucha incertidumbre, produjo muchas pérdidas, mucho estrés, sufrimiento, malestar, tanto individual como colectivo. Aumentaron diferentes cuadros clínicos y los consumos problemáticos. Y crece en el mundo la preocupación por los suicidios. En muchos aspectos nos estamos recuperando, pero otros requieren aún de mucho trabajo. En este encuentro, lo que nos importa es enfatizar la recuperación plena del bienestar psicosocial de la población, transformando la salud mental para todas las personas. En la Argentina, hace tiempo, estamos trabajando este tema con el Ministerio de Salud.
Thank you very much to His Excellency, Mr. Alberto Fernandez. It's very interesting to hear about the steps being taken in Argentina. And in the report itself, you can find lots of examples of how different countries are tackling mental health. So from Argentina to Botswana, we are very lucky to have with us Her Excellency, Mrs. Neo Jane Misisi, who is the First Lady of the Republic of Botswana, who's going to talk about a group of people whose mental health can be at particular risk. Thank you.
Thank you, Director of Ceremonies. His Excellency, Mr. Alberto Fernandez, President of Argentina, His Excellency Antonio Guterres, Secretary General, United Nations, Dr. Tedros Adhanom Ghebreyesus, Director General of WHO, distinguished guests, ladies and gentlemen, good afternoon to you all. I'm most honored to have been invited to speak at this significant occasion, marking launch of the World Mental Health Report, Transforming Mental Health for All. If we're truly to transform mental health, we need to fully understand its key determinants. And these range from the embedded traditional, religious, and cultural norms, peer and societal pressures, to emerging determinants such as unlimited and unregulated exposure to technological platforms. Social media, of course, included. In many instances, mental health promotion and financing are prioritized, and are not prioritized and remain stigmatized. Active engagement of communities and consumers of mental health services should also be given the due prominence, the ideal being appropriate quality services provided in an equitable manner without causing financial burden. Ladies and gentlemen, if we ensure that society appreciates mental health beyond disease, this will go a long way in addressing the stigma and misperceptions around it. If each one of us were to wear lenses which view mental health as a part of the daily struggles that people encounter with life stresses, coupled with being a part of an accommodating, empathetic community, this will transform the way mental health is perceived and addressed. This will in turn influence the way we define it, we plan for it, and resource it. In my view, addressing all of these through an all of government and all of society approach will ultimately transform mental health. Allow me to share some efforts made by Botswana in transforming mental health. Mental health is integrated with other services nationwide, and currently a comprehensive draft law is due to be tabled in Parliament. Its intention being to create an environment that assures quality, equitable service, while promoting and protecting the rights of people who require mental health services. The government has also embarked on an exercise geared at enhancing capacity of the workforce that deals with mental health by supporting mental health specialists and upskilling general health staff, including those in related professions. Furthermore, there's a shift of service delivery towards non-specialized settings in the community, underpinned by the introduction of community health workers.
Very much indeed, Your Excellency, for those words. Now, next, we're lucky enough to have some words especially recorded for this launch today by the Secretary General of the United Nations, His Excellency, Mr. Antonio Guterres.
We are living through a global mental health crisis. Nearly 1 billion people around the world, including millions of children and young people, have a mental health condition. Most of them lack access to treatment. Services may be unavailable or unaffordable. Stigma also prevents people from seeking help. People with mental health conditions are at increased risk of physical and emotional abuse, denial of education and employment, and other human rights violations. The costs, both human and financial, are huge. Depression and anxiety alone cost the global economy an estimated $1 trillion per year. While the COVID-19 pandemic has increased mental health problems, it has also led to a far greater understanding of the importance and fragility of good mental health. Unfortunately, in most countries, mental health remains the most neglected area of health policy. In response, the World Health Organization is launching its World Mental Health Report, Transforming Mental Health for All. The report is a roadmap to guide countries in improving their mental health systems. It highlights where improvement is needed and how it can be achieved, starting in childhood and continuing throughout all the stages of life. It sets out ways to reduce risks, build resilience, and dismantle the barriers that prevent people with mental health conditions from participating fully in society. I congratulate the WHO on this timely report, and I recommend it to governments and mental health stakeholders everywhere.
Apologies for some of the sound problems some people were experiencing there. And also for anyone who's having problems with interpretation, rest assured, the team behind the scenes is working on that. Thank you for your patience there. And thank you very much for those words there. Now, I've read this brand new World Mental Health Report, and it is extremely comprehensive. It includes all sorts of striking examples of what can work, and whatever evidence you might need in your work to see real change happen, the chances are you might find the statistics there that you need, because this is a really huge piece of work. Now, Dr. Tedros Adhanom Ghebreyesus is, of course, the Director General of the World Health Organization, and he is here with us on this very special day, and is going to say a few words on mental health and why it is we need this report.
Thank you so much, Claudia. Can you hear me?
We can hear you
loud and
clear.
clear.
Thank you. Your Excellency, President Alberto Fernandez, Your Excellency, First Lady Neogen Masisi, Your Excellency, Minister Andrew Little, the State Secretary Byong Sanger, Secretary General Antonio Guterres, and also to all our panelists. Would like to start by thanking Juliana Velasquez and Enoch Lee, Ahmed Hankir, and Anju Joy. Thank you so much indeed for joining us today, and we're very, very grateful, and I don't take it for granted. I really appreciate your dedication and commitment, and look forward to your words. And Excellencies, dear colleagues and friends, COVID-19 has underscored the intimate links between mental and physical health. The pandemic has taken a huge toll on mental health, a toll we don't yet fully understand. WHO estimates that already common conditions such as depression and anxiety have increased by more than 25% since the pandemic began, adding to the nearly 1 billion people who were already living with a mental disorder. At the same time, COVID-19 has highlighted the gaps in the capacity of health systems around the world to address mental health conditions. Investment in mental health remains low, and the stigma surrounding it remains high. On average, countries spend around 2% of their health budget on mental health. And in some countries, there are as few as 2 mental health workers for every 100,000 people. And yet, mental health conditions remain one of the leading contributors to the global burden of disease. We know it's possible to reduce the treatment gap for mental health. WHO's World Mental Health Report highlights the latest scientific evidence, showcases examples of good practice from around the world, and gives voice to people's lived experience of mental health conditions. The report calls for 3 fundamental transformations. First, to deepen the value and commitment we give to mental health. This means stepping up investments in services for mental health, putting in place evidence-based policies, and including people with mental health conditions in all aspects of society to reduce the stigma and discrimination. Second, to reshape environments that influence mental health. This means action to address risk factors for mental health, including violence, abuse, and neglect, improving early childhood development, and banning pesticides that are associated with 1/5 of all suicide globally.
Now, next, I'm delighted to introduce from New Zealand, the Minister of Health, Andrew Little. And we hugely appreciate you joining us because you have stayed up very late in order to be able to join us live. So thank you very much for that. And the approach that you've been taking to mental health in New Zealand is closely aligned in the direction championed in the World Mental Health Report. And you're going to tell us a little bit about what you've been doing there. Thank you.
Thank you, Claudia, Director General, Secretary General, Leaders of State, esteemed fellow ministers, colleagues, and all, tēnā koutou katoa, greetings to you all. My name is Andrew Little, as Claudia has said. I'm the Minister of Health in New Zealand. I have the privilege of speaking to you today on behalf of the Prime Minister, the Right Honourable Jacinda Ardern, who is unfortunately unable to attend the event. But I'm honoured to join you here today for the launch of this important report, Transforming Mental Health for All. It's the first of its kind. Developing our understanding and appreciation of mental health is incredibly important. Mental health has often been seen as a taboo subject, or even something refused to be acknowledged as a legitimate health condition at all, while simultaneously affecting large portions of the Earth's populations. We can and must do better, and I applaud the World Health Organization for leading this report. While often seen as a paradise at the bottom of the globe, New Zealand is not immune to mental health challenges. Our mental health system has been underfunded and under-supported for too long. It's heartening to see the direction outlined in the report is strongly aligned with the work already underway to transform New Zealand's approach to mental health and addiction to one where people are supported to stay well and have access to help that works for them. Similarly, considerable effort has been made to reduce the gaps and address the challenges highlighted in the report that are relevant to New Zealand, such as equity. We launched Kia Manawa Nui Aotearoa Long-Term Pathway to Mental Wellbeing in September 2021. This outlines our government's high-level plan for transforming our approach to mental health and wellbeing over the long term. This plan recognises that change requires a collective, multi-sectoral approach with government agencies working together. Kia Manawa Nui also emphasises the importance of engaging and listening to people with lived experience. I note the report highlights the importance of strengthening community-based care for all in need. This has been a key focus of our approach through a program called Access and Choice, giving people access to free and immediate mental wellbeing advice and support when and where they need it in a way that suits their needs. We're supporting new ways of reaching people, including by placing mental health workers directly in general practice clinics and enabling people with mild to moderate mental health and addiction needs to access support immediately and without referral. We're also partnering with local organisations to create culturally appropriate and equitable support for the priority population groups. We're rolling out tailored services for Māori, Pacific peoples, youth, and rainbow communities to provide support not always found in more mainstream services. The success that we are seeing from these programs speaks for itself. I'm also pleased to see the report acknowledges the importance and value of school-based mental wellbeing programs. We've seen this value in New Zealand. We created a program focused on building resilience to support children in schools following the devastating earthquakes in Christchurch over a decade ago. It has proven so successful that we have rolled the program out to other regions across the country, co-designed with local services and tailored to meet the needs of each community. We also acknowledge the need to better protect the human rights of people with mental health needs. As a society, our views on mental health evolve, and we now increasingly recognise the importance of well-being. 30 years ago, New Zealand's mental health legislation was viewed as forward-thinking, with its focus on providing community-based care in the least restrictive manner. But this legislation hasn't kept pace with a shift towards a recovery and wellbeing approach to care. We're therefore currently working to repeal and replace our mental health legislation with one that better protects people's human rights. There is plenty of work ahead, but change is already evident and the commitment and momentum is there. The Transforming Mental Health for All report is clear that we can and must do more to improve mental health. The same applies for us here in New Zealand. Supporting our people's well-being, both physical and mental, is vital to ensuring strong, resilient, and healthy communities. Tēnā koutou katoa.
Thank you very much indeed for that, Minister, and very good to hear what is happening in New Zealand. And we will let you get some sleep, although you may want to stay awake because we now get to the content of the World Mental Health Report itself. Now, as I said, it is very comprehensive, and I'm sure people will want to read it for themselves. But to get a flavour of what's there, we're joined by Ms. Deborah Castell, who is Director of the Department of Mental Health and Substance Use at the World Health Organization. And just to say, there's a few people still saying that they have some sound issues. If you do go back, if you're listening in English and you go to the original English audio and you click on that when you've gone to the globe, it is sounding very clear there. But thank you very much for joining us. There are lots of things I want to ask you. First of all, why produce this big report on mental health right now?
Thank you, Claudia, and allow me to say thank you to all participants and speakers. It is amazing to see how many are with us today. I mean, in 2001 was the first time that WHO produced a global report on mental health, and that report at the time generated a momentum, some attention, increased awareness around mental health, the dimension of the problem, the challenges, but also we came with a way forward with the recommendations. 10 recommendations were listed in that report. Then 20 years later, the recommendations are still valid. Some progress was made, but if we can show just one slide with a few numbers, we today have nearly 1 billion people globally with mental health conditions. We have that 1 in 100 people dying are due to suicide.
That very powerful story there of the man, such a good example of what you're talking about. Now, it is hoped that this report will have an impact worldwide. And next, we're going to hear from Ms. Bjorg Sandkjær, who is State Secretary of International Development in Norway, who has kindly made a video for us.
Ladies and gentlemen, dear friends, congratulations to the World Health Organization on today's launch of the World Mental Health Report, Transforming Mental Health for All. We have been waiting for this report. More than 20 years have passed since the World Health Organization published its last World Report on mental health. The challenges were huge 20 years ago, but they are even bigger today. Almost 1 billion people live with a mental disorder. The COVID-19 pandemic has had a severe impact on the mental health and well-being of people around the world. But the pandemic has also raised the attention about the huge needs in this field. Mental health has been a neglected aspect of the development agenda. It's high time that mental health issues are fully integrated and prioritized in our work to promote universal health coverage and strong health systems. I appreciate that the report presents solutions. It's clear that a comprehensive and transformative approach and action both within and outside the health sector is needed to provide good mental health for all. We need to reshape environments that influence mental health and strengthen health systems to combat stigma and exclusion. Mental health is nurtured at home, at school, in communities and at work. It's crucial to have a primary healthcare system with prevention, diagnosis and treatment also for non-communicable diseases, including mental health. Unfortunately, we are far from that situation in most low-income countries. Most health systems are not equipped to provide good mental health services and psychosocial support. I recently visited Nepal. As part of my program, I met with the LGBTQ community and I visited a crisis management center at Patan Hospital, which offers survivors of gender-based violence medical and judicial assistance. These meetings not only impressed me with the work they're doing, but reminded me about the importance of strong health systems. Norway is proud to support the World Health Organization's special initiative on mental health, where Nepal is one of the 8 countries currently included. The program is a game changer and supports governments to develop strategies, policies and capacities to deliver professional mental health services to the population. As the report states, investing to transform mental health means investing in a better life and future for all. Health is a human right, and Norway will continue to support the mental health agenda, including through integration in efforts to promote universal health coverage. We encourage more partners to join and support this work. Thank you.
Thank you very much for that. That was Ms. Bjorg Sanker, the State Secretary of International Development in Norway. And next, I've noticed that lots of people in the chat have been saying, what about schools and colleges and education? So next, we are focusing on young people, many of whom we know have had a very tough time during the pandemic. So I'd like to welcome from Delhi in India, Ms. Anju Joy, who has spent half a decade working to reform the public schools system in India. And she is the Chief Programs Officer now at Generation Mental Health, which is a youth-based global mental health organization. Welcome to you. Let me ask you, first of all, why is it so crucial to protect mental health while young people are still at school?
Hi, Claudia. Am I audible?
Yes, we can hear you perfectly. Yeah.
Okay, that's awesome. Hello to everybody from India, and thank you so much for having me here. In response to your question, Claudia, I think a fact that often goes completely under the radar, right? And it goes almost unacknowledged is the role that mental health plays in achievement, right? And especially in learning achievement, but also in any kind of success in later life, is often just completely neglected. And before transitioning to the field of mental health, which is now what I pursue full time, I spent over about 5 years in education reform in India. I've also been a teacher, and during my time as a teacher, I taught public schools. I taught in a public school in India, 3rd graders and 4th graders, math, science, and language. And I think the biggest observation during my time as a teacher, which was also highly consistent, was that my students who struggled with their emotional health, with their mental health, were also the ones who struggled with accessing higher areas of their cognition, right? Children, and I had over 90% of my students were from low-income communities, came from really adverse circumstances, marked with alcoholism, abuse, and a wide variety of other difficult circumstances, right? And in class, I would try to teach them how to solve sums, but they had bigger problems to solve at hand. And that is something I just noticed consistently. And I think, yeah, after 5 years, without a doubt, I think it's very clear that mental health and achievement have very strong and bidirectional links, right? And given the amount of time young children and adolescents spend in schools, it's highly important to integrate mental health care into education, right? And I think Ms. Deborah Kessler was talking earlier, it's about people having fun, right? And you cannot have fun at school if you don't feel safe, if you don't feel loved. So yeah, integrating mental health care into education, I think is of the highest importance.
So what can be done to change the environment at school to foster good mental health?
Yeah. And I think I just read this in the chat, right? I think somebody posted mental health is everybody's job, right? And what that means is teachers and other stakeholders in the education system also have a very critical role to play in creating conducive environments for learning for children and everybody else involved in educational settings, right? And I think one way to do it, and I think as a teacher, I did not experience this. I was a very young teacher at 22, no experience at all in classrooms. And I had no idea how to address the issues that came up in my classrooms, right? When I would hear stories of my students going through the kind of things that they're going through in their homes, I would be at a loss. I didn't know how to address it. What I knew was I had a syllabus that I had to complete, right? I had a curriculum that I had to finish, but there was no orientation towards how can I make my teaching and learning practices more trauma sensitive. And I think that's an orientation that not just teachers, school leaders, all stakeholders in the education system need to have to be able to provide safe learning spaces for children. It doesn't, I don't even think it needs teachers or anybody else to do anything additional, right? It's not some new task or new job that you have to do. It's just that you have to, whatever you're doing already, you just need to do it a little differently, right? You just need to acknowledge the fact that the student's mental health is important and perhaps is what will lead to any kind of learning achievement. And really, I think internalize, I think the knowledge that kids need to first feel safe and loved in order to learn. Right. I think just really holding on to that will transform, I think, the way we look at classrooms, transform the way we look at education, I think. And I think in that process, what will happen is I think we begin to create a generation of young people who feel very empowered and who feel like they can make decisions in matters related to their mental health, right? And a lot of the work that we do at Generation Mental Health speaks directly to this, right? How can we give voices to young people to actually make decisions in matters that impact them the most at the end of the day, right? And hopefully build a resilient world. Thanks, Claudia.
And when you, I wanted to ask you something else. When you said you wanted to give voice to the young people, when young people are given a voice, are you finding that they are becoming happier to talk about their mental health?
I mean, increasingly, yes. And I think you mentioned this at the beginning, right? Like in the past that you noticed that people didn't want to be named, people didn't want to talk about, there was so much more stigma. But I think as time is passing, as people are talking more about it, people are coming out to the front. And also I think as research and evidence are showing how strongly mental health is linked to almost everything else, right? There is change that is happening. And now I think people are a lot more open to talking about their experience. I mean, I don't think 10 years ago or 15 years ago, we would have people with lived experiences, right, on this panel. And today we have so many people talking about their lived experience. So yeah, I think that's amazing, and change is happening, but of course, a lot needs to be done.
And if you could do anything in schools in India, what would you do? Would you send all teachers for training then, or would you have other people come specially into schools as well? What would be your absolute ideal?
Yeah, I think it's a little bit connected to what I mentioned earlier, Claudia, is just almost a reorientation, right? You don't have to do anything new. You just need to do the things that you're doing a little differently, right? You just need to acknowledge if a child is going through something difficult, you just need to feel equipped to address that, right? To reflect that feeling, to paraphrase whatever they're going through, to clarify how much is it impacting them, right? And that itself can make so much of a difference. And I think somebody else, I think Julia, in a performance talked about it, right? If you just listen, there's so much of a difference that can be made. But I think teachers right now are not oriented towards approaching education like that. So training, educating teachers, maybe grounding them in some of this neurobiology, right? Like how much is your emotional health connected to your cognitive abilities? I think that's extremely important.
And I guess it's hard because the teachers can't change everything about the rest of a child's life. They can't change the rest of their environment. They can just make school a safe place.
Yeah, I think what is within their control is, I think, those 6 hours, right, that they get with the child in the classroom in a day is within their control. And so much can be done during that time. And I think that should be the focus. Well,
thank you very, very much for joining us, Anju. And very best of luck with your work as well in India. And lots of people talking on the chat there about what sorts of things could be done in schools and what sorts of things you could do in different places. Now, before we end, I'd like to invite back Ms. Deborah Castell, who is Director of the Department of Mental Health and Substance Use at the WHO, for a couple of final thoughts. And I wanted to ask you, first of all, how would you really like people to use this report and put it to best use? You know, we have people from all around the world here. What do you want people to do with it? How could they use it?
Thank you, Claudia. I think that when we were preparing this report, we were having in mind continuously the people working at country level trying to make a change, and how could we facilitate or support their efforts. That was the main concern and perhaps the target group that we were looking at. So I would like the report to be used for that. If the increased interest that we have discussed about, the increased awareness, okay, many actors want to do different things in the countries, want to advance this agenda. Okay, we believe that this report should help them doing that there are enough experiences in each one of the areas that we mentioned to look deeper into them. There are scientific references all along the report to learn more about the specific ones that they may be interested in, or to get in touch, reach out to those who have done something interesting and explore ways of doing that. We firmly believe that a lot more than is happening could be done, more concrete actions from policymakers at every level, and we think that the report should provide the tools, should facilitate that information in order to then make that action take place.
And do you think then that it's having the evidence, it's having the experiences to look at, but also having good evidence and good data? Can that make a change?
Yes, I think that we can assure those interested to move forward that whatever is written in that report is based on scientific evidence. And so the data is there and the evidence is there. It's just a matter of deciding that things could be done differently and then move on.
And the report includes, as you say, examples of action that have been taken in different countries as well. And these are really varied, aren't they?
Well, yeah, and I mean, it will be hard and unfair to name some because there are many, but you can have there a number of examples from different aspects. We try to illustrate every single piece of information that we were included with an example coming from one reality or the other. And you have a number of countries from each one of the regions across the world, and not only from the farther East Asia to the other extreme of Latin American countries, or the African and the European and the US and everybody, or many countries are there included, but also different level of income or development, as mentioned, from low middle income countries and high income countries. We try to show that not always the development depends on availability of resources or the well-being of the country itself. It may depend on a serious commitment to make things happen.
And finally, in the future, in, I don't know, 10 years or 20 years' time, when the next big report like this comes out, what would you like to see that has changed in mental health? Can you paint a picture for us?
Well, I would like to see mental health care offered and available for everybody who needs it at the community level. I would like to see that places of isolation and segregation and punishments are not existing anymore. I would like to see that human rights violations are not easily associated with mental health or with people with mental health conditions. I would like to see people with mental health conditions speaking openly everywhere about their challenges or sufferings or achievements, and having a voice in every decision, as it was mentioned earlier by Ahmed. I would like to see that anybody at any place, at any time, going to see a carer, a health carer, to talk about their problems with HIV or diabetes or pregnancy or childhood or older adults, anyone going to see a carer will be listened also for their mental health needs or issues. And whoever will be on the other side listening to that will know what to do. That's what I would like to see, that mental health is part of health actively, in real life, in reality, and not just in slogans.
Well, let's see what happens, and I hope that all comes true. Thank you very much for joining us. Now, we are nearing the end of our time for this launch, and what a lot we've covered, from the very practical, like the 24-hour emergency telephone lines, which we heard about from the President of Argentina, the steps being taken in schools in India, to the big ambitions for global change, for change everywhere. We've heard some really moving experiences and songs. It's not every day you get songs in a global mental health conference. And we've also heard the real support there is out there at the highest levels, evidenced by the people who have joined us today, to make lasting change in this area. I was very struck by the words of the Director General of the WHO, who said investment into mental health is an investment into a better life and a future for all. And the First Lady of Botswana, who said how much difference it would make if everyone was part of an empathic community. And the Secretary General of the United Nations, who said in mental health, there are no vaccines, but there are actions. And I think all of these are such important phrases to remember. So Your Excellencies, colleagues and friends, thank you for all those supportive words. And thank you everyone who shared their personal stories and reflections. It has been so powerful to hear from governments, from mental health advocates, and from celebrities. And these are multiple voices, but they have the same message, that we must and we can do better for the world and its mental health. And I'm very much looking forward to seeing this happen. So thank you very much. Thank you for listening, and goodbye.